So we're so glad to have the opportunity to talk to you today from the RAND team. We want to tell you just a little bit about the CARE Act independent evaluation that RAND is conducting. Um, we just want you to know a little bit about what kinds of data we'll be collecting and why, and what your role is in helping us with that data, and answer any questions you have. So next slide, please. I pretty much just said that, but the goal is to provide you with an overview of the independent evaluation, including what data we're asking from you, the counties, and why we're asking for it. And so our agenda is as follows. We're going to introduce the RAND team. It's just going to be me talking for now, but we think we'll have other members of the team available for Q&A at the end. Um, we're going to talk about what data we're collecting, again, why we're collecting it, and then we'll talk a little bit about how the data is going to be protected, just so you can know you feel really comfortable submitting data to RAND. So that's the agenda for today. Go to the next slide, please. So just to introduce you to the RAND team. I'm co-leading this project along with Melissa Labriola and Steph Holiday. Steph is on right now. I think Melissa is going to join us a little bit later. And then some other key folks she'll be interacting with are Amy Shearer, Rachel Burns, who is our quantitative lead, and Wendy Hawkins, who is our project manager. And I saw at least Wendy is on the line as well. And so this is your RAND team leads. You might hear from other folks at RAND as well, but these are kind of going to be the main folks you might hear from. Um, yeah, so that's who we are. Let's go to the next slide. Just to say, actually, I'm going to introduce myself more since I'm talking, but before I go into it, so I'm a senior behavioral scientist at RAND. I have been at RAND for 15 years, and for 14 of those years, I've been working on evaluating California mental health programs. I've had the opportunities to work on statewide efforts as well as with many of the counties. So there's some of you who may have seen me before. So I'm passionate about this work, and I definitely see it from the county perspectives as well as from the state perspective. So just excited to do another important evaluation because I know CARE is very anticipated in the state. In terms of the goals for our evaluation, we want to evaluate the implementation of the program, the outcomes of the program, and the impact of the program. So what did CARE accomplish, and why does it matter? What does that mean for the individuals you serve and for the state as a whole? We also want to document lessons learned related to the CARE Act model and policies, and we want to make recommendations for ongoing implementation of the CARE Act. So whenever we evaluate, it's not to be say good job or bad job. It's really to understand where we need to improve quality going forward. Because I think we all have the goal of serving people to the best of our ability. And so that's where we hope to focus our recommendations so that we know how we can serve them better going forward. Next slide. We go one slide ahead, please? Oh, great. So this is an overview of the data sources we're going to be using for the independent evaluation and your role as counties in helping us with those data sources. So I'm going to go through them one by one, and we can talk more about any individual one later if you guys have questions. So one key data source is qualitative data. So we like to interview people to gain an in-depth understanding of their experiences, and we want to have the vantage point of multiple stakeholders. So to that end, we'll be interviewing staff, we'll be interviewing participants in care, and we'll be interviewing petitioners as well. In terms of your role, we'd like your help identifying staff members who are playing key roles in the care implementation, as well as care participants and petitioners. So we'll need your help reaching out to those folks. And so this won't be a representative sample. It'll be more of what we call a convenience sample, meaning we'll talk to who we can to understand their vantage points and get that richness. We'll be getting more complete data from other sources, which I'm going to talk about. Um, one key data source is existing administrative data. So we'll look at things like Medi-Cal claims data, HCI data, et cetera. The purpose of that is to understand the characteristics of the people served and the services they received. There's some data that is better gotten through administrative data than data dictionary, and then conversely, the reverse is true depending on the particular data point. In terms of county role, you have no role there. We will getting this data from the state, and you don't need to do anything. Um, Another source of data that's very valuable is the data dictionary. So we'll be pulling data dictionary 2.0 data elements. And again, we want to use it to, HCI, gosh, hospitals. I'm having trouble thinking of the acronym, but it's hospitalization data that we can get centrally through DHCS. I'll put the acronym in the chat later if I can think of it. And I saw that question pop up, but I think I'll mostly keep most questions to the end, but thank you for that. Sorry to acronym out. It's not helpful. So the data dictionary elements will also help us understand the characteristics people served, what services they received, what did they get through care. And so you are already submitting that to HMA. So this isn't a new thing. This is something that's already ongoing. And then the last data source that we have is surveys. So we're going to be doing a more rigorous care. Oh, thank you. We're going to be doing a more rigorous care respondent survey. And then we'll also be doing a very brief petitioner survey. And the purpose of the survey is to elevate the voices of people served by care and understand how care may be benefiting them. And so the reason to do a survey, there's a bunch of reasons and I'll talk about it, but it's mandated by statute, so we have to is one reason. The big reason is we want to hear from everyone involved, and we don't want to feel like we're cherry picking any particular individuals. We want everyone who's served by care to have an opportunity to let their voice be heard. Um, and so we are not asking for anything additional or special for the survey. We're actually going to recruit participants based on information provided in the data dictionary, assuming we receive sufficient data. And I'm going to say more about that in a minute. So let's go to the next slide. So we're talking more about the survey because that's where we've been hearing from our partners at HMA that there's the most questions. But of course, we welcome questions about the interviews or anything else. But in terms of why we're serving care participants, as I mentioned before, a participant survey is the best way to elevate the voices of individuals served, give everyone served the opportunity to let their voice be heard. And we also need to measure essential outcomes such as recovery that we can't get from any other data source. So based on the data you're submitting to data dictionary or administrative data alone, we won't know how folks are doing in terms of key aspects of recovery that are important to them and important to us. So that's why the survey is so important. Next slide. Um, I think I've been hearing that we've been getting questions about why we need petitioner contact info alongside care participant contact info. There is two reasons for that. So one reason is we are hoping to go through petitioners to help track down care participants. We know that individuals that you serve with serious mental illness and a variety of other concerns, unstable housing situations, etc., are really hard to reach. And so in our experience doing surveys like this, petitioners or folks around folks served tend to have much more stable contact information. And so they can be a really valuable source for facilitating connections to people who are hard to reach. And we do want everyone to have the opportunity, again, to say their piece. We also want to learn a little bit about petitioners' perspectives and experiences. So, of course, submission of petition is an important part of care. So we want to ask a little bit about how that went for you, what's working well, what's challenging. And so that will be a short ask. We'll have a couple questions about that. And then we really want their help in tracking down the care participants, which is central again to the evaluation. So it's both of those reasons, learning from them, but also learning from them how we can track down those hard to reach individuals that we want to hear from. Next slide. Okay, so a question that we may have heard is why is the data dictionary contact info the best way to get contact info for the survey? We strongly feel this is the least burdensome method to counties because it uses an existing process rather than a separate ask. So we could go to specific counties and say, hey, can we get all your contact info for petitioners and the people you served? But that would require a lot more hands-on collaborative work with counties. So it would really add to county burden because you'd be hearing a lot more from us in terms of trying to get this. And it's not practical to do it from all the different care counties. So we would be forced to sample just a subset of counties. And so we'd be capturing fewer voices of the individuals served, which we don't want to do. We want every county and every individual in the county to have an opportunity to participate in the survey. Um, and so we looked into lots of other potential pathways to get contact info through different interfaces, different ways individuals touch the system, but none of them were feasible. This really is the only feasible way, is to do it through the data dictionary. And I think it's the way that's least burdensome to counties, which we know how burdened you already are. Next slide. So I mentioned that this request was supported by statute. So pursuant to this particular code, it says the independent evaluation has to include results of a survey of program participants, and each county behavioral health department, each county care court, and other state or local government entities should provide the required data to the department in a format and frequency as directed by DHCS. To me, this is kind of legalese. You know, I'm a clinical psychologist. I didn't mention I'm not a attorney, but DHCS and their attorneys determined that it will have to rely on county behavioral health departments to provide the requested data in order to fulfill its statutory obligation. And the data points that I already described are valid and within scope to collect. So I feel like it's legalese, but this is kind of like the why we have to. I'm much more focused on why we should want to, which is again, elevating the voices of individuals served, making sure we hear from everyone who has something to say, etc. So next slide. We thought you might want to hear a little bit about how we're going to protect the data because this is, sensitive data from vulnerable populations. I just want everyone to know that RAND does have vast experience with storing and analyzing sensitive data. We routinely process protected health information or PHI. We also process secret and top secret data for the Department of Defense and others. I personally have a security clearance, not that relevant to this, but we just take data safeguarding really, really seriously. We have a lot of processes to make sure that sensitive data is protected. Some examples of that are that files are encrypted and password protected. When we receive data with identifiers, we get it in a locked cold room that only certain RAND staff can access. It's not connected to any other network, so the data is kind of isolated until we make certain that there's no identifiers on it. And then we can process it through other secure means. And our offices are guarded and require badge access for entry. So very, very highly secure environment. So just want everyone to be aware of that as well. Next slide. That might actually be it. Yeah, that's it. So I understand this was a little bit of a whirlwind tour of our evaluation, what it's trying to do, and your role. So we really invite your questions at this point. I think we can take this down, and people, if you want to go on camera, you're welcome to, no pressure. And I do have some colleagues that help me answer your questions as well, as I mentioned. So what questions do you have? Are there ones that came up in the chat? I wasn't closely monitoring it. The HCI question. Sorry
No
about
other
that.
questions.
Okay, what questions do you have?
Hi, Allison Woolley, SLO County Behavioral Health Justice Services. I have a question regarding the process, and I see a lot of barriers to connecting with respondents through their petitioner for a few reasons, specific to just what we've experienced with care. So I think the challenge with this is that occasionally the petitioner is a family member. That family member may or may not have a release of information with that petitioner or with the respondent. And the respondent may not have a good relationship with that petitioner. So using the petitioner to contact the respondent, I think can potentially be one, harmful to the respondent, two, not sufficient means of connecting with the respondent for that reason, unless the petitioner was a care provider that is a current and active care provider, um, somebody that's actually engaged in providing treatment through care. I think that the connectivity there you're going to find is not that feasible.
Yeah, thank you for that question. I think I need to provide a lot more detail about all the different ways we're going to try to track people down. So, first and foremost, we'd love to just use the contact information of the individuals being served, right? So that's kind of like our um
Mhm.
first way to go at it, directly through there. If that fails, then the petitioner is a way to help track them down. That doesn't necessarily mean that the petitioner is the one reaching out directly. They're just going to provide us help with how to figure it out. They might say, oh, their contact information changed. They used to be at this location, now they're at that one. So they're not going to necessarily be the one trying to do it. They'll just be providing us what they know about how to do it. And sometimes it's going to be even like very anecdotal is not really the word I'm looking for. They might be like, hey, they hang out around this McDonald's even, and then we can track them down. And we also have a multi-stage strategy for tracking down participants with increasing kind of the reach. So the first level of reach is kind of like email blasts, see what we can get from that. The second level is calling people. And the third level is literally trying to track them down in person. We'll send out teams to different counties and try to track them down. So we just need any breadcrumbs we can because 100% agree with you. This is a very hard to reach population. We have a
Mhm.
survey research group that really literally specializes in reaching hard to reach populations. We've done lots of surveys with people who are unhoused, unstable, in lots of different ways. We know this is a hard to reach one, which is exactly why we want every little possible clue we can get about how we
Mhm.
can reach them. And it's honestly going to be very individual. And it will look different for different folks. Some people will get in that first kind of email blast, and some people are going to be like an in-person track down kind of situation. Um,
Um,
so yeah.
one more comment. I just think that for just for our population specific to what the population looks like where we are in SLO County, folks tend to not have a cell phone or access to a
Mhm.
computer or an email address or a physical address. Folks that have been petitioned so far are chronically unhoused, have been, moved through the justice system for many, many years, or have, been released from a state hospital and have, been, in long-term facilities for the majority of their life. So haven't really had the ability to establish contact information like you're speaking to. So
Yeah.
I think it's a really big barrier when you're talking about specifically to our county and the population that we've looked at through petition process. And I kind of want to make a recommendation that I know you don't want to pass this down to counties, but we're already collecting data in 2.0. Maybe we could provide you a quality of life and services survey, and you could produce the survey, and we can just have clients fill it out like on intake at a 6-month interval and then at completion of graduation. So then you're getting like a cross spectrum of data, and you'll be getting it from clinicians who are providing direct services and are meeting with that client. And I think that that's going to prevent that barrier, that access problem that you're talking about or that I'm
Mhm.
talking about. I don't see it being feasible to collect data from the population specific to our county. I'm not sure, can't speak to all the other counties. They may have better access and better information, pipelines. We have limited service providers, and not everybody has an email address right away or a cell phone right away.
Yeah.
So, I think that for us, that's just a barrier to sharing that information. And I'd love to be able to collect that type of data. I think qualitative data and also data that speaks to outcomes specific to this program, it's lacking in the current data that we're providing. And I think it would be a really nice addition if that were at all possible. And it could be something where RAND creates like a survey form that every county has access to. And they just, in the midst of talking to the client on intake. Once they're actually part of a care agreement, they would fill out this survey with their, you know, supportive person, you know, case manager, clinician, whomever happens to be in the office with them at that time, at intake, at 6 months, and at completion. I think that would give you a better picture as far as outcomes and probably prevent the barrier to access that I foresee with the lack of contact information specific to our people in this county.
Yeah, Alison, I agree with so much of what you're saying. I think the fact that they don't necessarily have stable contact information is exactly why we're asking for petitioner contact information. I know it may not exist in a way we'd like, but like, the petitioner might have awareness. Oh yeah, this person's now couch surfing at this location, or that you can find them there. And so I think that difficulty of tracking them down for all the reasons you said is exactly why we want to know every possible way of possibly tracking them. It is really challenging, and we have an obligation to try to do it anyway. What you're suggesting in terms of having the counties implement the survey, I think we'd have to give that a lot of thought. I have a few concerns. One is that although your county might be willing to do this, we may not have willingness to submit a survey across 58 different counties. Like, I suspect many won't have the bandwidth or willingness to do it. Another problem is that it's supposed to be an independent evaluation. And so when it's perceived that the people who are providing the services are the ones that are surveying you, that can create bias or can create feelings of vulnerability if they feel in some way that their services could be jeopardized by giving an honest response in a survey like that. So it's not then the independent survey that's mandated by statute if we do that, even though I see all the advantages that you're saying, like you're right about everything you're saying. It just, I'm not seeing it as workable for both statewide, for both the logistical reasons of I don't think every county is able to do that, and then also the issues of bias and vulnerability in terms of the person who's giving you services asking you, what do you think about these services, is a challenging thing that I don't think would actually meet our statutory obligation or our, ethical obligation to make sure their voices are heard in a way that they feel comfortable speaking. But I see what you're saying because we don't want to miss people altogether as well. So it's just really, really challenging for all the reasons you're saying. I'm not trying to oversimplify it. I know just how hard it is, which is why we want to come at it from every angle possible. Um, does anyone on the team want to add anything or from the RAND team? No, okay, shaking your head. But I see that Susanna's had her hand up for quite a while. I'd love to hear your question.
Sorry, I didn't catch that. My internet's kind of going in and
Oh,
out.
just what's your question? I know your hand's
Oh,
been up.
I have three kind of comments. One is, I
Sure.
kind of echo the difficulty of being able to contact people, and I see Kara put a comment as well about legislatively, it is not required for us to provide the client's contact information or the petitioner's contact information. Um, it's not in the actual code that we provide that data point. So there's still some gray around there about the privacy concerns. I would echo that. I think that my second comment is really around there hasn't been any information going out to clients, to people, asking if they know about this and if they're interested. So it's like a cold call for them. If you, I mean, we don't even really have good contact information per se. Um, they don't have a computer, they don't have a phone, they don't check email, that kind of thing. And we contact petitioners if the petitioner is a family member or someone that knows the client, because some of the petitioners behavioral health or a hospital, um, it's not all our petitioners that are family members. And we contact them asking, hey, have you seen them? Or not.
Right.
And sometimes there is not a relationship where they're not interested in engaging in that. The one thing the legislation does say is that their status as petitioner is confidential. So you're asking us to give up their contact information for you to contact them when it's confidential. They get a cold call from someone who's like, well, why do they have my information? Um, that's weird. But there's nothing going out to actually share with either petitioners or the people involved in care court that we're interested in you. We'd like to hear your voice. This is what we're thinking about doing. Would you like to participate? There wasn't an ask on the RAND side to the people who you would like to have participate. And so there's that challenge in actually getting people involved in wanting to share their experience or their information. So is there any plan to provide a
Yeah.
flyer or ask the people, is this something you would like to do? That people may call and ask you about this. I think they would still feel pretty, for lack of a better term, burned in a way if we just give up their contact information and they get a cold call and be like, I trusted you, and then you broke that confidence. So there's a real risk there in terms of burning our own rapport with both the client and the family, if that happens. And if it happens in that way, and has there been any thought to bringing together incentives and advertising and having people gather to and be able to talk to people? Because I think your sample is going to end up being really biased, because those who have a lot of challenges and don't want to be in care court are going to talk to you.
Yeah.
And so there's,
oh,
there's those issues as well.
yes. So there's a few questions in one. So in terms of flyers, absolutely, we plan on sending flyers. We'll send them to every way that we have contact information. So addresses, emails, whatever we have, we definitely will be providing flyers. So hopefully a call is not the first time they hear from us. If we don't have a way to reach someone with a physical address or an email address, it might be a call, because again, we have to kind of do it every way we can. So
I was
absolutely there
thinking
will
through
be.
the program, because the people that are
Yeah.
actually on the ground seeing people would be a way to actually disseminate information about a potential participation in that kind of a survey
Yeah,
or
absolutely. We
discussion.
would, yeah, we'd love to provide flyers to the programs for you guys to distribute. We'll definitely do that. Um, and in terms of, so yes, absolutely flyers. The second thing, sorry, I should have taken notes while you were talking. I want to turn to my DHCS colleagues about the requirement. Flyers, yes. Oh, incentives, yes. Yes, we're providing incentives. We're going to be reimbursing people for their time. So we'll make sure that they understand that they're valued 100%. There will be monetary incentives so that their time is reimbursed at an appropriate level. So yes, we are doing that. I should have mentioned that. And then the third thing is about the extent to which it is required by statute. This is something that the attorneys at DHCS looked into. I don't know if any of our DHCS colleagues can say more about that than I can. Oh, Andy's on.
Yeah, I mean, I don't think I want to say a lot about it. I'm not an attorney either. I don't want to say a lot about it, but I think our attorneys have determined that we have the ability to collect it. I don't think we can give counties legal advice. I know they all are pursuing their own legal guidance, but just as to the extent the data are administratively available, we're asking counties to provide it. I think that's all we can sort of say from the legal perspective. I think a lot more of this is about what Nicole was talking about already, about the feasibility, what's going to encourage folks to provide information and feel comfortable that their data is safeguarded if that contact information is provided, and ideally share their perspectives.
Mm-hmm. And then just to thank you for that, Andy. And then to get to a couple things in the chat. Yes, we are recording this meeting and we're going to send out the recording as well as the slides. Oh, Wendy already said that. Sorry. And then Monique Brown says, I don't believe the petitioners have ever been considered private and confidential since we're required to provide the respondent with a copy of the original petition via CARE 107 notice. So
Providing the correspondent a copy is very different than providing an outside independent organization their contact information.
Mm-hmm. I think the question is whether they've been told it's confidential, but I'm hearing that you feel it's a
Pretty
violation
much
of the trust.
confidential is stamped all over it, so I don't know.
Mm-hmm. No, I'm definitely hearing that you feel that usually when things are confidential, it's confidential within the team that's providing things. So for instance, with HIPAA, which everyone on the call is very familiar with, it's permissible to share information within HIPAA providers, because it's all on the same goal of doing what we're doing. And so that's a different level. Even though it's extremely private and we protect the information, it's known that within the team providing care, you can share information for care purposes. And so typically for quality improvement purposes, it's considered the same kind of standard where confidential within the evaluator is still considered confidential, but I can see how on the ground it may not feel like that to someone who's a petitioner. And understanding how important it is to preserve those relationships. So I'm hearing what you're saying. I think there's the legal, also what you feel comfortable with. And I'm trying to think about if there's ways that we can improve the comfort. And so I'm wondering if, for instance, like, of course, we're definitely going to provide a flyer about the opportunity to be an evaluation, but maybe you need something that you can give petitioners as well that's a little bit separate from that. I think we can
I think
think about that and
consent.
bring that
I,
back.
I think
Yeah.
consent is where it would be. You're asking for consent to text, but not consent to be contacted or participate in that independent evaluation. So I think the key is just consent, like just as from a simple respect perspective of, are you okay with someone contacting you for this, and this is what it is for? And there could be incentives involved if you'd like to participate. We're interested in your voice. We'd like to hear from you. But I think that just the simple respect of asking people is better than, here you go, I'm going to give up all your information.
Well, I think they absolutely have to give their consent to participate. No one's going to participate without their consent. I see what you're saying about consent to contact. I think that's something that DHCS legal looked into, and they determine, and you can disagree, that it's not necessary from a legal perspective, and it would be a barrier that would be cumbersome for many counties. If in your county it's something that you feel is not too cumbersome and would be helpful to do, then obviously there's nothing preventing you from doing that. I think it's just not something that we would prescribe because it doesn't seem like it's legally mandated, and for other counties that might be a barrier.
I
So
think
I
they're
think
asking
that's,
for consent to text in data dictionary, which means we have to work a process to, in fact, ask for the client's consent to text. So far, we've just coded it in no, because now we do, in fact, have to put in place a process to ask for their consent to receive a text. It's a data element.
yeah, I think
I
that's
mean, why
where
not
the
go the whole 9 yards then? I mean, I don't understand the difference between asking for a consent to text or asking for a consent to, hey, we're going to give you information for this person to contact you.
Yeah, I think for us, the consent to text is legally mandated, whereas the consent to contact actually isn't for the reasons that I described. But I understand that each county might make their own determination. But I think that we don't want to add additional barriers to counties that do feel comfortable with the legality of sharing it. So we don't, that's why it's not done consistently across the board, because legally you do need consent to text, but you don't need consent to provide the contact information to the evaluator. So we just don't want to add burdens to where there doesn't have to be ones necessarily. So, but if counties want to add that, they certainly can.
Thank you.
Thank you. Let me just see if there's anything in the chat that's helpful to, let's see. I see Wendy's responding to some of this. We are putting it through our IRB, even though it's evaluation for quality improvement, not technically research. But let's see. Yeah, hearing your concerns. What other questions do you have?
Hi, I have a question. Um, Based on the process, would it be possible to kind of converse with the California folks at California Justice, and make a determination about integrating like a release, or like Rand's going to contact you as part of the petition, like add it as like a box that they can check, we're willing to be contacted, and that we're willing to share our information with Rand just in the Care 100 form? Is that something that could be considered so that counties feel protected in sharing that information, and petitioners know that they have the potential to be contacted by Rand? If they check this box, then they know, like, we know that we can share that information with you, and then the petitioner knows they'll be contacted, and it prevents all of these, potential issues.
Mm-hmm.
Is that something that could be done?
That's an interesting suggestion. Thank you for that. We did reach out to Justice and we found that it was not possible to get the petitioner contact information through them. I don't think we specifically did ask about adding that checkbox to the form. I don't know if others explored that more closely. Andy or Steph? No, Steph's shaking her head. Andy, is that something that we could look into, or is that not going to be pragmatic?
I don't personally know the answer to that question. I don't know if anybody else from DHS on the call knows, but
Okay.
if not, we can look into it. We can see if it's been investigated.
Okay, we'll look into that.
Thank you very much.
Thank you, Allison. Kara?
Hey, how are you? It's been a long time.
Good, how are you? Yeah.
Good, good. This wasn't the question I was going to ask, but just curious why the justice kind of said they wouldn't give up the information. I didn't have the information or wouldn't be feasible. But then I have a question after.
I have to say I don't recall the exact details, but just that we thoroughly went down that route and we hit a dead end. Does someone remember the details of that and can explain it better than I can, which is not well at all? Seth.
I don't know that I recall it. I think that there may be a challenge with it not being collected in like a centralized place where it would be easy to, for example, export all of the petitioners and their contact information to us, which is what I'm recalling is the reason.
I think that was it too, that it was very idiosyncratic how the different counties were storing it. There was no like mechanism for transmitting it. Versus that would put us back to the whole having to deal with 58 counties separately and then having to sample only a subset and some counties being left out. And that is sounding correct, Steph. Yeah.
Yeah. So just a couple of things. Just one, I share the concern Susanna had about just how much data you're going to get. I think in the end it may be sampling anyways, depending on, we still need to discuss further, I think, with our county council and figure out what steps we need to take internally to feel more comfortable with this information, sharing this information. But I just wanted to make sure I'm understanding correctly. So there will be no direct data exchange between counties and RAND, right? I just want to make sure I have that understood. That
That's
it'll be
correct.
between us and HMA and that agreement through. Okay.
That's correct. Everything is just part of the data dictionary process. And then HMA transmits data to RAND so that we're trying not to ask a ton from you. I know it doesn't feel like that right now. Like, but
Well,
yeah,
it was more in the instance of whether we needed to engage in a DUA or something with you guys if we had to
no,
send data. So it sounds like that's not needed for this. Okay. Thank you.
correct. Thanks, Kara. And so we actually are going to try to collect data from the, I'm seeing a good question in the chat. We are going to try to collect data from people who take all the paths. So care plans, care agreements, as well as voluntary. So we're going to try to get it all to the extent possible. Other questions?
I just want to reiterate again that the Care 100 form has confidential written all over it. As a person that's filling it out and filing it, I would assume that my information would be confidential.
Yeah, I think the distinction is confidential within the care team. So, when you fill it out with this person, you assume that other people who are involved in that team, or maybe you don't assume, but other people in it's not like, so I think legally Rand is an extension of that team, but I understand it may not feel that way to you or to the petitioner. Um, but I think that's where it is, just like the HIPAA example I gave. So I'm hearing that people may not feel that they or anticipate being contacted, and so that there's different ways we have to make them feel more expecting of this. And so one way is that some counties may want to layer additional consent procedures if they don't feel comfortable. Another way is just socializing it with the flyer, like you suggested, Susanna. So I do think, yeah. I think there's two different layers, what's legal and then what's also going to make people feel comfortable and, like you said, not burn connections that you guys have been working really hard to develop and cultivate. Oh, Laurel?
Hello, I'm Laurel Ben Hamida with Reducing Mental Health Disparities Coalition, REMCO, and Mass Social Services Foundation out of Sacramento. We work particularly with refugees and immigrants, many Afghans, Iraqis, Syrians, et cetera, et cetera, et cetera. And I'm enjoying the discussion on confidentiality because I see that your research is well designed in so many ways, but now we have this issue going on. We have so many people in California. We're a majority minority state who are in fear now of any kind of action by immigration to deport them. And I'd like to know, I always ask when it comes to this kind of research, how are you going to take care of people that you want to contact who don't speak English? But now too, there's a really increased layer.
Mm-hmm. Thank you for that, Laurel. I think yeah, thank you. We are collecting this data in a very challenging environment where people, I think their level of trust and their anxiety is higher than ever before. So thank you for pointing that out. We do have a lot of procedures in place, like I mentioned during the brief slides, to protect their data. Whatever data we not provide and will provide. We could consider something on the recruitment flyer to make that crystal clear, given this tough environment. You're absolutely right about the language accessibility. We are able and plan to provide the interview as well as all recruitment materials in Spanish as well as English.
I think that those resources ought to be there for this. If the evaluation of care court is going to be legitimate, then you have to reach out past. What I'll say is, like, this is not a legitimate evaluation.
Yeah, I hear what you're saying. So in the preliminary data we have, the vast majority of individuals served by CARE do speak Spanish or English, but you're right, there is definitely a population that does not speak either language that we would miss. And so I think things about that is, one, we would have to, in any evaluation report, we'd have to call out that we were not, if we don't include them, we have to call out that we were not able to include those languages, and that because of that, it's not a full picture of CARE. So we'd have to, of course, say that. Luckily, we do have other data sources from individuals in all languages, such as the administrative data I mentioned, like claims data. Claims to be feasible. But I can at least acknowledge it and make it clear that if we aren't able to do languages other than Spanish for the interview and the survey, that would be a significant limitation, of course, of those. And that we'll try to get the full picture through other data sources if that is the case. So I agree with you. But thank you for raising that.
All right, thank you.
I just want to also raise that claims data. Are you talking claims data like billed services? Because some of these services are not billed because the client doesn't have Medi-Cal. They're uninsured.
Yeah.
So I don't know if you're planning on using CSI service data or if you're using claims data, because the non-billed services aren't going to be in the claims at all.
Yeah, that's one of the reasons to complement the data from the claims claims data with the data dictionary data, they have different strengths and weaknesses. So definitely claims is only people who have a claim. It's only billed. So you're right about that 100%. And then, you know, the dictionary data has different limitations, and that's why we're going to use as many data sources as possible and triangulate them to get the fullest picture of what's going on. Every data source is going to have different limitations, just like the survey and interview will have a limitation if we're not able to offer Spanish languages beyond Spanish. So I think we just hope that if we get enough perspectives, enough data sources, we can get as full a picture as we can of care. It'll all be imperfect in different ways, but hopefully when you look at things from many imperfect vantage points, you get an overall pretty accurate picture on balance, is the hope. Just looking at whether it's a random sample of the population. Actually, no, we want to reach out to everyone and give everyone the opportunity to have their voice be heard. Everyone can get an incentive if they want to do it. It will, I don't think we're including people who are petition is dismissed. So we are including those who then go on to get voluntary care. So I think we won't have information if their petition was dismissed, like, because they won't even be in the data dictionary. Is that correct, or am I misremembering that? We'll try to reach out to people at as many different phases of the process as possible. And we're not planning on sampling for the survey like we will for the interviews. That's one of the unique strengths of the survey, that anyone who wants to have their voice be heard can let their voice be heard, and they can get an incentive for doing that. Other questions? It's great that you can include the dismissed. I think dismissed was not a category that we were planning on including. We can take another look at this. We're planning 300 categories of like voluntary agreement and plan. So if their petition's dismissed, I don't think they're going to have enough to talk about really in our survey, but I'll take another look at that and we'll think about that a little bit more.
Aren't they dismissed involuntary?
Aren't they dismissed involuntary? Well, there's
Dismissed, and then they voluntarily accept services.
Yeah,
Elected clients.
I
Is
can
that what
drop
you're talking
the,
about? Yeah.
Yes, that's been our experience in our county. When a person enters into services voluntarily through, or they may have met criteria, but we engage them and they're now in services specific to their level of care. If that were higher than, say, an outpatient treatment setting or higher than an FSP level, right. Then we're still providing them care, but their case is dismissed and they haven't entered a care agreement or a care plan.
Yeah, thank you I was being imprecise in my language. So elective clients, their petition's dismissed would be included. If your petition is dismissed and you don't seek any more services, we would not be serving you because there's not much you would have to talk to us about, right? So, but elective client, that pathway is included in the survey. And I know that's been a major pathway that a lot of folks are engaging in. So we definitely want to hear from those folks. Okay, well, I just want to say I really appreciate the time you've all spent with us today. You have such nuanced understanding of the individuals that you serve and the challenges there. And we see those same challenges. We just want to do the best we can to let them have their voices be heard. I think everything we do will be, like you said, imperfect, but we're going to try our best because we so want to hear about how folks are doing, and we so want to understand particularly how they're doing with respect to their recovery. So I'm seeing there's more comments in the chat. Let's see. Yeah, we will be interviewing folks all throughout the spectrum as well. Steph, do you want to say anything about the interviews since that's coming up as well?
Sure. I'm just reading through the comments too to make sure that I know what the interview
we are looking at the
was.
dismissed in terms of the outcomes numbers. Allison definitely will look at that.
Oh, yes. And in terms of interviewing people, yes, we are expecting that our interviews are also going to cover all of the different populations as well. With the interviews, the thing that we always have to keep in mind is that the number of folks that we'll be able to reach is even smaller than what we're going to be able to reach through the survey. But the intention of those is really to dig in much deeper about the process and about the experience. And so some of these questions that you are interested in, we are interested in too. Like, what is it that folks are struggling with? Like, what is the process like for them? What are the interactions like with different people? Do they feel like this is filling gaps that weren't being filled before? And so that will be a priority for the interviews that we conduct. We won't be interviewing clients from every county because those are such in-depth interviews. We're going to be selecting a sample of 12 counties ultimately over the course of the evaluation, and we'll be interviewing clients specifically from that subsample of 12 counties. They have not fully been selected yet. We want to wait to get a sense of the volume of where petitions are being filed, where agreements and plans are being put in place. And then we also want to make sure we get representation from counties with different characteristics. So it's not just all large Southern California counties, for example, but we'll continue to communicate with folks about our plans for those interviews once they get underway and once all the counties have been selected.
Mm-hmm. Well, thank you so much for joining us today. I think like we said before, you'll be receiving a recording of this as well as the slides. I think if you have further questions, you can reach out. Maybe Wendy, could you put your email in the chat as kind of the liaison to the team, and then Wendy can triage your questions to the different team members that would be best able to answer them, because I know maybe not everyone had a chance to answer questions, or maybe you're percolating a little bit on it, and as you think about it more or discuss it with other members of your county team, you may have more questions. We do want to be available to you for those questions. I think with that, we might close so you can get a tiny break before, I'm sure you all have 1 o'clocks as well. So just thank you again for your attendance and for your thoughtful questions. We do really appreciate it.